This week on Healthy Living, the World Health Organization says there are achievements in eradicating Guinea worm. Discussions on mental health struggles due to stigma remains taboo among many Rwandans. Plus, labs in East Africa are using mice to confirm tuberculosis. We'll have these stories and more in this edition of Healthy Living. Hello and welcome to Healthy Living. I'm Kamiti Kibayasi. Neglected disease are conditions that inflict severe health burdens on the world's poorest people. Many of these conditions are infectious diseases that are most prevalent in tropical climates, particularly in areas with unsafe drinking water, poor sanitation, substandard housing, and little or no access to health care. According to National Human Genome Research Institute, every year 1.7 billion people are affected by these diseases. They cause immense suffering, stigma, disability, and sometimes death. Guinea worm diseases, for instance, is waterborne, while sleeping sickness is transmitted by the tsetse fly. The World Health Organization celebrated World Neglected Tropical Disease Day on January 30th. The Atlanta-based Carter Center is continuing to make progress in the fight against Guinea worm infections. VOA Kani Farabo has more on these countries in Africa are working to rid the world of the parasite.
Guinea worm infections numbered in the millions in the 1980s. For 2021, just 15 new cases were reported, and in 2022, a total of 13.
Which does not sound like a big reduction, but when you're dealing with very small numbers in very remote areas, we take it as a huge step forward.
Adam Weiss is the director of the Carter Center's Guinea Worm Eradication program. When his organization, founded by former U.S. President Jimmy Carter and his wife Rosalind, began spearheading the effort to rid the world of guinea worm in 1986, the parasite existed in 20 countries. In 2022, just 4 countries reported new guinea worm infections in humans.
We had 6 human cases in Chad, 5 human cases in South Sudan, and 1 in Ethiopia, and 1 in the Central African Republic on the southern border with Chad.
It's both good news and at the same time not so good news.
Dr. Zirahun Tadase Kebrselassie is the Carter Center's senior country representative in Ethiopia, which is on the cusp of complete eradication.
We are doing surveillance by moving from house to house in each and every village, which have been historically reporting cases. So we found only 1 person, and we found him before its clinical manifestation, which means we suspected that this could be a guinea worm case. We kept him in a facility called Case Containment Center.
The Carter Center also provides financial incentives for people to report any potential guinea worm infections. That, coupled with a program to educate people on the importance of safe drinking water, as well as continued parasite monitoring efforts, is driving progress on the path to complete eradication.
We have to get rid of all cases for 3 consecutive years.
One of the biggest setbacks to declaring the world free of guinea worm was its discovery in domesticated animals and wildlife.
It was a punch to the gut back in 2012 when we first started seeing infections.
But after years of dramatic increases in the number of dogs and cats in remote villages carrying the parasite, 2022 showed encouraging results.
The last several years, we went from several thousand animal infections to this year being just over 600 animal infections in the world.
But the magic number in the overall eradication effort is 0 cases in both humans and animals.
We have to get rid of it from all hosts in order to meet the definition of eradication.
We are like in the last mile, which is the most difficult one.
If the effort is successful, guinea worm would be only the 2nd disease eradicated from the planet. but the first through prevention, since there is no medicine to treat infections and no vaccine to prevent them. Kane Fairbaugh, VOA News, Chicago.
To learn more about how neglected diseases are treated in our communities, let's hear from Dr. Elisha Osati from the Muhimbili National Hospital in Dar es Salaam, Tanzania.
Neglected diseases, first, there are a lot. There are a lot of neglected diseases worldwide. In Tanzania here, we consider five of them. And everyone have a different modality of treatment, but mostly the treatment are either antibiotics or antiparasitics. So when you talking about, for example, here we have schistosomiasis. We also have things like trachoma. We have filariasis, and we have different forms of intestinal worms. We have big campaigns that are going around. Some of them funded by USAID in collaboration with the Ministry of Health Tanzania, for example. Because most of these neglected diseases are because of their genes. Most of them are because of the worms that are available in the environment. Some of them through we say fecal oral. So because, for example, trachoma, the flies that act as a vector for trachoma, they will lay their eggs in the soil where these feces. But again, intestinal worms, for example, they also lay the eggs when there is with the human feces. So it is important to clean the environment. So that's one that can help us, and through the health education to eliminate people to clean their hands. You know, the trachoma, for example, can be transmitted from a mother who is caring for a child. This is why it has been called a nursery disease. So it cannot travel through the placenta, but after a child has been born, it can be transmitted from a child to mother or from mother to child by the contact, because it can be transmitted through the contacts. If you touch your eyes and then you touch again eyes of somebody else, you can get a trachoma. So it's not possible to be transmitted to unborn child, but a child that is a nursing mother can transmit to a child.
In Rwanda, the prevalence of one or more mental disorders among the general population is 20.5%, according to the 2018 survey on mental health in Rwanda. Discussing mental health struggles is still taboo among many Rwandans due to stigma. Against this background, 10 female visual artists organized a 2-week exhibition in Kigali.
The art exhibition Walk With Me in Kigali, Rwanda reflects the realities of life for some patients with mental health complications and possible ways to support those who are vulnerable. The artworks by 10 female visual artists range from drawings, photos, and paintings. Jemima Kakizakimani-Zanya is a visual artist trained in mental health counseling. She explains the initiative.
I've always been interested in mental health because it's a taboo subject, and I think that we all get affected. From the history of our country to COVID-19 recently, I believe that this is something we really need to talk about.
Christelle Arras, a French photographer, is also exhibiting her photos taken in Ivory Coast, which showcase women who were using drugs. Some of them abandoned the practice after their photos were published, which exemplifies the power of art in changing the status quo.
I did portraits, presenting them as fashion models. When they saw those portraits, there were touching testimonies as 1, 2, and 3 women said that these portraits revealed the person they should be if they were not taking drugs, and that gave them the courage to stop taking drugs.
The event organizers say the exhibition, a new one of its kind, attracted more than 300 visitors in 1 week. Dr. Jean-Pierre Ndagijimana is a senior mental health expert who focuses on stress regulation training. He says recent data on mental health in Rwanda are alarming.
It's concerning because the numbers and the statistics and the stories are a little alarming. Based on the most recent National Mental Health Survey that was conducted in 2018, in terms of the major depressive disorder, the general population, the prevalence was at 12% of the people that were surveyed, while for the people, for the genocide survivors, was at 35%. That's scary, to say the least.
According to health experts, Rwanda has seen a rise in mental health issues as a result of intergenerational trauma due to the genocide against Tutsis in 1994 and the high rate of unemployment among the youth.
Laboratories in Tanzania and Nairobi are training rats to sniff out tuberculosis. Already known for finding landmines, the rodents could possibly transform the detection of the diseases.
These African giant rats have hero status with the scientists at the Apopo Project, a Belgian non-profit organization in Tanzania, thanks to their ability to sniff out tuberculosis. Apopo is known for training rats to find landmines, but training them to detect TB was new territory when they began using the program back in 2008. Now, the animals work in 21 medical centers in Tanzania's capital, Dar es Salaam. Program manager Joseph Soka believes that rats are faster at detecting disease-causing pathogens than other standard testing methods and hopes the WHO approves their method of TB testing soon. For WHO approval, a 90% accuracy rate is required.
We did accuracy study way back and we found that the accuracy of these rats as compared to culture was 75%. We are planning to do another better accuracy study. We hope that because the initial accuracy study, they have some shortfalls, we think we will do another accuracy study, and we hope the accuracy the sensitivity of these rats can reach 90%.
According to veterinary pathologist Daval Shah, 50% of a rat's nasal lining is covered in scent receptors, which is why they have a superior ability to detect scents compared to humans who only have 5%.
So the conventional laboratory techniques can take anywhere from 2 hours to even 14 days per sample, depending on what technique you use, while the rats would be able to accomplish testing of 50 samples within 2 hours. And this would be ideal in far places or remote places like Mozambique or places in Mozambique which are rural.
According to the WHO, TB claimed the lives of 1.6 million people in 2021, including 187,000 people with HIV. Many developing countries heavily rely on old TB detection techniques that entail the use of microscopes to examine potentially infected patients. The disadvantage of such techniques is that they are more time-consuming and can be negatively affected by poor equipment. In the hope of overcoming these challenges, the scientists at Apopo and Lancet, Kenya, continue their life-saving research with the help of their hero rats.
That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. Please follow me on Twitter at MkamitiVOA. Until next time, stay well and strive to make it every day a healthy day.